Selby here with Allison Baker, a third-year kinesiology student at Guelph Humber, and today we're going to be performing a series of upper back strengthening exercises. We're going to be using both the TheraBands as well as body weight. Now this is a red TheraBand and it has a medium amount of resistance. Different name brands of bands are going to have a different color coding for the resistance, so do find the resistance that's best for you. Now Allison's going to be performing a standing row. With the row, you want to make sure those shoulder blades are retracting back together and depressing down. Don't let them elevate up. You don't want to get into that motor pattern. Now her weight's going to be on the ball of the foot. We don't want her sitting back on her heels. Keep the weight on the ball of the foot so that you're well balanced. Okay? So Allison, I'm going to get you to perform a repetition of that, please. So as you squeeze the shoulder blades back, she's pulling them down at the same time, and you can see that the wrist-elbow alignment is straight. Allison, tip your wrist down for me, please. As she tilts her wrist down, you can see what happens to the shoulder. That shoulder at the front tilts forward. We don't want to see that. We want that shoulder pulled back, so do keep that wrist and the elbow completely horizontally oriented. Now, back with control, resisting the pull of the band. Don't let the band pull you, you control the band. And again, pull that back, really squeezing those shoulder blades together, keeping the wrist and the elbows lined up as they pull down. Now you're going to perform as many as you can with a good form. Now remember, as you pull back, don't sit on your heels. Keep the weight on the toes. You want to really make sure that your weight is going through the ball of the foot, the front of the foot, not the heel. Okay? Now this exercise you can also perform in a seated position. So if Allison sits down and wraps the band across the balls of her feet, now you'll also get a stretch in the legs. So if your hamstring muscles at the back of the thighs are too tight, this may be challenging for you to do. Now you're going to sit up nice and tall, maintaining that natural inward curve to the lower back, which is straight. And again, we want to really feel those shoulder blades work together. So go ahead and perform a couple of repetitions, keeping those elbows nice and tight to the body as she pulls back. Stop, hold for at least a 1/1000 count, and then nice and controlled. Resisting the pull of the band. Okay, your chin is going to stay nice and down. Allison's got a really good position with her head. Her chin's not stuck out. Her head's not flexed forward or extended backwards. Very nice. Okay, so you can make sure that when you do this, you don't lean too far back. You don't want to be leaning back. You don't want to be rounding forward. Just a nice neutral spine position. The next exercise we're going to do is a shoulder retraction with the TheraBands. Can I get you just to stand up, please, Allison? Now, when you're doing any kind of weight-bearing exercise, you want to make sure you have a little bit of a micro bend to the knees. Don't stand on a locked out joint. Again, the weight is through the ball of the foot, not the heel. Now, you're going to extend your arms out to about 90 degrees, no more. If you increase the angle past 90 degrees, the shoulders have to elevate, and we don't want that. We want to try to keep the shoulders down, depressed downwards as we retract them. Now, Allison's going to stretch her arms out, and she's going to pull that band apart. She's going to stop at body line. So once the band touches at the chest, that's as far back as she's going to extend, and then she's going to close that up. If it's too little resistance, tighten the band up. If it's too much, loosen it down. Now come all the way forward again. So the shoulder blades have spread out, and then she's going to retract them back, really squeezing those blades as she pulls down the shoulders. Stop, hold at least 1/1000, and then nice and controlled on the way back. Again, you're performing this exercise as many times as you can with good form. So that could be 5, it could be 15. It's dependent on how many you can do with good form. Now, the only thing we want to see, just a little bit different, is a nice straight wrist. Don't let the wrist deviate to either side. Don't let it cock back or forward. Just a nice straight wrist. Very good. So this exercise is going to open up through the chest in terms of stretching out, and it's really going to work those muscles in between the shoulder blades that we just worked with the rows. Now the next exercise we're going to do is called a push-up plus. For this one you don't need any equipment. It's a body weight based exercise. Now it is not a push-up. So when you perform a push-up plus, do not let the elbows excessively bend like you would in a push-up. So Allison's hands are going to be at or just below 90 degrees. Again, if they're above 90 degrees, that shoulder blade has to raise up, and we don't want that to occur. So she's got a really good angle. Now a good straight body line. Don't let those shoulders rise up. She's going to feel her chest move to the wall as the shoulder blades squeeze together. And it's a subtle motion. The shoulder blades can only squeeze so far. And then she's going to round out through the back, really feeling her chest move away from the wall, and then she's going to go back into that position, squeezing those shoulder blades together. The chest moves in towards the wall, the body moves as one unit, and then relax out of that position, rounding out. So now the shoulder blades are spread apart. Now she's going to retract them again. Good. So the shoulder blades are going to stay down into depression as they retract, and they're going to stay down as she protracts them forward. Excellent. Do a couple more of those repetitions, please, Allison. Really feeling those elbows stay nice and straight. Don't let those elbows bend into a push-up. They'll bend a little bit, that's okay, but don't let them bend excessively. So a progression from a standing push-up plus is into a push-up position on the floor. Allison, can I get you to get into a straight leg front plank? So anybody who's done planking, which most people have, you want a good straight body line when you're planking. And we can see that there's a vertical alignment between Allison's shoulder, elbow, and wrist. And from the shoulder down to the ankle, she's got a good straight body line. Now her head is in an excellent position. She's got a nice neutral neck, a little bit of a chin tuck, looking at the ground. If she pulls her head up, looking at herself in the front mirror, puts a lot of extension through the neck, which can stress it. So look at the ground again, please, Allison. Now, same exercise, a push-up plus, so don't bend those elbows excessively. Go ahead. So feeling those shoulder blades squeeze together, the chest drops towards the ground, and then push out of it. Now, one of the things, as you can see, is Allison's got quite a curve to her lower back. That is her natural inward curve to her lower back. Her back is not excessively arched for her because, again, she's got that good straight alignment between her shoulder and her feet. Okay, try a couple more of those for me. Feeling those shoulder blades squeeze, the chest drops towards the ground, and pop out of that. Excellent. Really spreading those shoulders apart. Very nice. Couple more of those, please, Allison. Squeeze together, stop, hold 1,000. Now don't let your neck scoot forward. Keep your neck in a nice neutral position. Excellent. Now, if you're finding it too challenging to do from the knees, you can do a modified push-up position. So you want to, again, straighten out the body line. So you're going to shift your weight so that you've got that good alignment from the shoulder now down to the knees. And we can, again, do the push-up position or push-up plus position in this modified push-up position. And then push out. Good. Couple more of those. Squeeze together, stop, hold 1,000. Nice and controlled on the way out. Excellent. If you do have any questions, do leave a comment below and we would be happy to answer them.